Okay, so today I'll be administering a subcutaneous and intramuscular injection. So just some safety considerations is that I need to make sure to look at their MAR, double check that it is the right patient I'm giving it to, check if they have any allergies, and then I'll go over my 8 rights. So I'll check that it's the right patient, right drug, right dose, right time, right site, right frequency, right route, and right reason. Okay, so next we have to figure out what needle, syringe, and gauge we're going to be using for these injections. So I need to assess my patient, and my patient is of average size. So for the subcutaneous, I'm using a 3 milliliter syringe, and I will be using a 25 to 27 gauge with a 3/8 to 5/8 needle length. And then for the intramuscular, I will be using a 3 milliliter syringe as well with a 20 to 25 gauge and 1 to 1.5 inch needle size. Okay, so first we're just going to prepare the subcutaneous injection. So we have to first do hand hygiene, and then we're going to apply our gloves. Okay, and then we have our medication here, which is the heparin. So we're going to take the cap off, and then we will dip it. And then we're going to take our subcutaneous injection. And according to the order, we are to give 1 milliliter. So we're going to take off the cap, and then making sure to not touch the vial. We're going to go directly into it, and then take it, bring it upside down, and fill it up to the 1 milliliter. We're going to take it out, and then I'm just going to flick it to make sure there are no air bubbles in there, and then using the scoop method, we're just going to put the cap back on. Okay, and then we're going to add a medication label, and here we're just going to make sure to put the patient's name, the date, and the time that the medication was given. Okay, so now we're going to prepare the intramuscular injection. So we're going to be giving him Haldol, and according to the orders, we're going to be giving him 0.5 milliliter. So we have our medication here. We're going to take off the cap, and then the same thing as we did before, we're just going to clean it. And we're going to take our needle. Okay, so I'm just going to take off the cap now, and then I'm just going to take some air in. And then that way, when we put it into here, that will just help with the air bubbles. And then we're going to put this up and get the 0.5 milliliter. Okay. We'll aspirate this as well, or get all the bubbles out of here. And then using the scooping method again, we'll just put the cap back on. Okay, and then the same thing with the subcutaneous. We're just gonna label this with the patient's name, the date, and the time. Okay, and then now I'm just gonna get rid of these inappropriate receptacles. And this. I'll take off my gloves and perform hand hygiene. Hi, Mr. Mancini. I'm here with your medications. I have your subcutaneous heparin injection and your intramuscular Haldol injection. So we're going to start off with your subcutaneous injection. First of all, can you just tell me your full name? Okay, and your date of birth? All right, and do you have any allergies? Okay, so I'm just going to double check your wristband. And I see here that you are allergic to codeine. Okay, so we're going to start off with your subcutaneous injection. So first I'm just going to landmark this area. So I'm going to do it on your abdomen. It'll be about 5 centimeters to the left or to the right of your umbilicus. I'm going to do it to your left side. So over here, and then I'm just going to palpate the area. Is there any tenderness? Okay, so first we're just going to clean the site. Okay, so before I start this whole procedure, I would perform hand hygiene and I would put on gloves. So I'm just going to do that now. But normally I would do it before the procedure. Okay, so we'll clean the site. And we're just going to start in the middle and make sure to go in a circular motion. Okay, and then I'm going to take the subcutaneous injection and take the cap off. And what you're going to do is you're going to squeeze the skin, and then we're going to go in at a 45 to 90 degree angle, and just go in quickly and slowly inject the medication in. I'm going to take that out and then apply pressure. Okay, and then for your intramuscular injection, we're going to do it on your deltoid. So I would find the patient's acromion process, and then I'd go 3 fingers down from there, and then right below that would be the spot that we're going to inject into. I would also palpate, again, like we did earlier, the patient's deltoid, see if there's any tenderness or anything there that we see abnormal. And then we would cleanse the site of the deltoid there, starting in the middle and going outwards. Take the cap off of this, and then for intramuscular, we're going to use the Z tracking method. So using the ulnar side of my non-dominant hand, I'm just going to pull the skin, and then with intramuscular, we're going to go at the 90 degree angle. So first, I'm just going to aspirate a little to make sure that I am in the correct spot. If there were to be blood when I pull it up, that would mean I'm not in the correct spot. But there isn't any blood, so I'm in the correct spot. So now I'm just going to slowly administer the medication. Okay. I'm going to take this off. I would have this, and I would firmly apply pressure on the site. Okay, then I'm just going to get rid of the stuff that I'm not using anymore, and these ones will go in the Schartz container. Okay, and then I'm just going to take off my gloves, perform hand hygiene. I'm just going to make sure that my patient's okay. Mr. Mancini, how are you doing? Okay, perfect. Okay, and then to finish off the procedure, I would go and document what I just did. So I would document the medication that was given, the time, how the patient took it, if there were any other adverse reactions that occurred.